I'm Digveer Jayas, Vice President Research and International at the University of Manitoba. I would like to begin by acknowledging that the University of Manitoba campus is on the original lands of Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and the homeland of the Métis Nation. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. Welcome to our second Café Scientifique this fall. The topic that tonight's panel of experts and moderator will explore with you is one relevant to many of us: parenting during the pandemic. They will share their expertise on what they are learning about many impacts this is having on families in Manitoba, which is certainly transferable to the experiences of parents in other regions of the country and world. I encourage you to participate in the conversation with our experts. I will hand things over now to your moderator for this evening, Dr. Leslie Roos. Let me briefly introduce her. She is an assistant professor in the Faculty of Arts and Rady Faculty of Health Sciences at the University of Manitoba, with appointments in psychology and pediatrics. She aims to prevent the intergenerational transmission of stress-linked health inequities by developing programs that promote parental mental health and family relationships. She is also a junior fellow at the Center on the Developing Child at Harvard University and affiliated researcher with Children's Hospital Research Institute of Manitoba. Merci, thank you, miigwech. Dr. Leslie Roos.
Wonderful. Hi, everyone. I am now unmuted. Nice to talk to all of you this evening. I'll be your moderator for today's discussion. As a quick overview of how we plan to proceed in our online Café Scientifique format, each of our panelists will speak briefly on their perspective based on their expertise for tonight's topic. I will then open things up for discussion. Questions can be posted via Slido. There's a link in the YouTube description in this feed you're watching and also on the screen throughout the discussion. I see it just popped up. You don't need any software to use this application, just an internet browser and the discussion code. I will be moderating questions from Slido as well as interactions with our panelists this evening, so feel free to post those questions at any time and they'll just be rolling. This brings me to tonight's expert panel. They are Drs. Kristen Reynolds, Susan Prentice, Emily Cameron, and Jennifer Protege. Dr. Kristen Reynolds is a registered clinical psychologist and assistant professor in the Department of Psychology and Faculty of Arts. She is a director of the Health Information Exchange Lab with work focusing on decreasing gaps in the translation of health-related knowledge to the public and increasing access to health-related information and services. Next, we'll hear from Dr. Susan Prentice, who is Duff Roblin Professor of Government, Professor of Sociology, and the former Margaret Lawrence Chair in Women's Studies. She specializes in overlapping fields of gender, work, and family and their connections to social policy. Her particular expertise is in childcare policy, which she'll tell us about more tonight. Next, we have Dr. Emily Cameron, who's a postdoctoral fellow in clinical psychology in the Department of Psychology. She holds a Social Science and Humanities Research Council Postdoctoral Fellowship Award to support her program of work, which includes working with myself and Dr. Tracy Afifi. Her expertise is in risk and protective factors that influence early child development, with a particular focus in parent mental health. Her work aims to inform the development and implementation of programs that address both child and parent needs to promote overall family well-being. Finally, we'll hear from Dr. Jennifer Protege. She is the Endowed Research Chair in Allergy, Asthma, and the Environment, and Assistant Professor of Pediatrics and Child Health at the Rady Faculty of Health Sciences. Dr. Protege specializes in mixed methods research and the impact of allergic disease on the child, family, and society to inform knowledge translation and policy. Thank you again for joining this evening. I'll start by asking Kristen to open this up with some remarks on how people are doing during the pandemic?
Thank you, Leslie. Manitobans have all experienced the impact of the sudden, uncontrollable emergence of COVID-19. And we as Manitobans continue to feel this impact today as rates of COVID-19 are rising in the second wave of the pandemic. So one of the research projects that our group was involved in involved analyzing 44 reflections on the emergence of the pandemic in Manitoba, published by the Winnipeg Free Press between March 28th and April 24th, right at the beginning of the pandemic here in Manitoba. One of the central storylines of our work was, and then came COVID-19, a quote from one of the writers demonstrating this sudden and impactful cascade of disruptions to of Manitobans following the emergence of COVID-19. Disruptions to daily routines, to relationships, education, work, finances, access to services, travel, and future plans. These sudden and impactful changes to the fabric of Manitobans' lives were met with a range of emotions, including sadness, emptiness, pain, loneliness, depression, anxiety, frustration, and anger. The lack of supports noted by writers of these reflections in the Winnipeg Free Press were notable and included many services that were once vital to segments of the public, leading to exhaustion from added responsibilities that people were facing, frustration, and feelings of abandonment. Another segment of our work involving COVID-19 has included looking at the experiences of people who are pregnant, postpartum, with little ones ages 0 to 18 months, their experiences with pregnancy and postpartum, their coping strategies, and their support needs. Next slide, please. Thank you. So when we look at the experiences of people who are pregnant and postpartum, and these experiences were drawn from two primary studies. The first, the Parenting During the Pandemic study, led by Dr. Leslie Roos at the University of Manitoba, and the second involved the Pregnancy During the COVID-19 Pandemic study, led by Dr. Leanne Tomfor at the University of Calgary. So in both studies, we used qualitative methodology to further understand what people were going through during their pregnancy or during their postpartum periods, how were they coping, and what did they need. In terms of experiences, we found people were going through lots of parenting demands, increased demands, pressure to do more with fewer resources. People were highly concerned about medical appointments, worried about vaccines, as an example, with one parent noting, "My baby is overdue for her 18-month shots right now, and I'm not sure what I need to do about this." Parents reported feeling isolated, noting reduced stimulation both for their baby and for themselves, and really missing these opportunities. One parent noting, and I quote, "I feel disconnected." Parents also noted a worry concerning their infant's development, socially, emotionally, cognitively, physically. How were the little ones developing, and what could they do to help that with an already demanding workload? Parents noted childcare as a predominant stressful experience, and we have Dr. Susan Prentice who will talk more about this up next. We also noted the experiences of pregnancy among essential service workers throughout both of these qualitative studies. One respondent to a survey noted, quote, "My work life in the pandemic has caused me a great amount of stress and anxiety. And being pregnant, I'm concerned by the work environment and schedule that I have been thrown into." When we looked throughout both studies at common ways of coping with being pregnant during the COVID-19 pandemic, the number one coping strategy endorsed by people who were pregnant and in the postpartum period included maintaining a social connection, whether that was virtually by telephone or having distant visits with people. This is one of the main ways that people were trying to stay connected and in touch with those around them. People noted practicing pandemic-specific coping strategies, including following public health restrictions, participating in hobbies, enjoying family time, spending time outdoors, and practicing self-care wherever they could. Participants also endorsed the need to reduce news consumption, having this as a driving force behind levels of stress for them, which was further corroborated by some of the quantitative work by members of our research team. In terms of support needs and recommendation, the experiences are vast, and though people are coping in many helpful ways, the support needs are clear. There's a need for clear pandemic-related health information based on evidence, made easily accessible to all Manitobans and Canadians. There's a need for specific, targeted, and accessible mental health services and supports, not a one-size-fits-all approach. So for example, for pregnant and postpartum parents, for frontline workers who may be coping with pregnancy or postpartum. Services available both online as well as through other modalities that will meet the needs of specific populations. And our members of our panel are working on intervention development for these particular groups. Additional forms of support, such as income support, should also be made a priority to mitigate the financial uncertainty experienced across the general public and especially among specific at-risk groups. Thanks for your time.
Thank you so much, Kristen. It's a very informative opening to our evening tonight. And next, I'll ask Dr. Susan Frentis to speak on some of her work on childcare policy and the impacts during the pandemic.
Thanks, Leslie. On Friday, March 20th, Manitoba issued stay-at-home orders and told us that regulated childcare centers would be shutting down that Monday. Childcare closures meant that parents who worked or studied suddenly had to work from home while taking care of children. What happened to them? So in this little talk tonight, I want to blend the voices of 15 Manitoba parents who we interviewed with some survey data done by other academics alongside some policy analysis. The short version of it, as one mother told us, was that parents needed to figure out what we were going to do with our kids. And in most Canadian households, mothers stepped up in ways that were qualitative and quantitatively different than fathers. Researchers at McMaster University found that the average Canadian woman with children reported spending nearly 50 more hours each week on childcare during the pandemic than did the average man. And although both women and men reported big increases, women were already spending more than double the number of hours per week on childcare than men were prior to the pandemic. So we probably should not be surprised that among households with children, women in Canada report lower average mental health scores than men do. The McMaster researchers concluded that women with childcare obligations saw a dramatic and disproportionate increase in labor as a result of the COVID pandemic. And our qualitative interviews with Manitoba parents showed the same thing. As one mother told us, it all kind of fell on my shoulders to maintain the house and the child and everything else. I found it awful. Honestly, it was awful. A second mother explained that 24/7, I'm the one on top of this. Another declared, I just tend to be the one that figures all these things out, just figures out all these moving parts. There are inequities in many households, even though it often seems taboo to name it. There's power in our marriages, in our families, and it's often unequal. One mother of a 4-year-old explained, sometimes it would lead us to kind of butting heads, and one of us would think that our job is more important than the other job, like when we had a conflict. And that was a source of stress. And there was a lot of guilt, more so with me. I felt it more than my husband. I felt more of the guilt. Another said, oh, I think of course it affected me more than him because he could still go about, his routine. I feel like I'm not as good of a mom. I'm not as good of a wife. My house goes to hell. Everything starts slipping. I feel like it will just get worse. The one dad who volunteered for our interviews acknowledged, well, we had different challenges. She watches him, their son, more during the day, so it's probably affected her more in some ways. When childcare centers closed down, parents, mothers, lost a crucial piece of the infrastructure that allows them to try to juggle employment and caring responsibilities. Pre-COVID, there was never enough. a space for fewer than 1 in 5 Manitoba children, and that is, by the way, well below the national average, and expensive at thousands of dollars per year per child. But even those lucky enough to have licensed childcare often needed to patch together more, regularly relying on grandparents and in-laws who became unavailable during COVID. And we don't even have that old childcare system back. 1 in 8 Manitoba facilities is still closed, and across Canada, the system is fragile and many services are teetering with bankruptcy. As a context, women's employment has changed a lot. The Royal Bank has showed that 1.5 million women lost their jobs during the first 2 months of the pandemic. That was 1/6 of all jobs held by women in Canada. Nearly half of all women worked fewer hours and so earned less money. Women tend to work in what the Canadian Women's Foundation calls the 5 C jobs: caring, cashiering, cleaning, catering, and clerical work. And as a result of this segregated work, women experience higher rates of infection, greater job loss, and less job recovery. And of course, some women, racialized women, Indigenous women, those with disabilities or who are newcomers, and others have it even harder. So last month, September, researchers report that 33% of Canadian women have considered leaving their jobs, compared to less than 18% of Canadian men. Women say they think about leaving their jobs because they find it too stressful to manage work and family during a pandemic, and they need to help their kids in school. And all of that was prior to the recent troubling wave of increased cases. So what's my takeaway from putting these together? Well, mothers have been slammed by the pandemic, and one important remedy is to make childcare services more accessible and affordable. Childcare is very far from a magic bullet, but it is essential. Childcare services in Manitoba, like all of Canada, were grossly inadequate prior to the COVID pandemic, and the crisis has made things worse. It's a deceptively important issue for economic functioning, for families and for children, and especially for women's well-being. It's time to take childcare really seriously. Thank you.
Thank you so much, Susan. That's very interesting, raising some really important points. For folks watching, banner just went up for our slido.com way to ask questions to moderators if something comes to mind while you're hearing someone talk. This is the URL to type in, and this is our code for our discussion tonight. Next, we'll hear from Dr. Emily Cameron.
Thank you, Leslie. As noted by Susan and Kristen already, parents in particular face significant challenges during the beginning of the pandemic, with many stressors ongoing and disproportionate for mothers. Clinically, in my work with parents and children, there was a clear shift around the uncertainty of the pandemic initially, and questions regarding the mental health impact for both parents and children. Given the many anticipated stressors and many media articles highlighting the assumed increase in mental health concerns during the pandemic onset, we were interested to evaluate the prevalence of depression and anxiety in parents of young children. As noted by both Susan and Kristen, qualitatively, there has been a lot of information around the struggles that parents have had. And we wanted to capture what those numbers might look like in terms of the impact of job loss and childcare. So in our sample of over 600 mothers in the Parenting During the Pandemic study led by Dr. Leslie Roos, we found that 1 in 3 mothers, 33%, reported clinically elevated depression and or anxiety symptoms in the first 2 weeks in April. This number, this 33%, is 2 to 4 times pre-pandemic rates for mothers of young children. And we looked at this across child age group as well, with mothers of slightly older children, more school-aged, having higher rates, closer to 40%. For fathers, our preliminary sample of 70 fathers that were collected from early April until the end of August, we found that similarly, 1 in 3 fathers reported clinically elevated depression rates, and 1 in 4 fathers reported clinically elevated anxiety. And these numbers are just lower than those rates for mothers. Given the prevalence in men in a general pre-pandemic population is lower than mothers. This actually suggests a 3 to 10-fold increase in these rates of mental health concerns. So the highlight here being really that all of the qualitative information we had about the struggles and all the assumed difficulty for parents and children is really captured in elevated mental health concerns for both parents. Risk for increased mental health concerns included a history of mental health diagnoses, financial strain related to COVID-19, lower relationship quality with a spouse, and increased parenting stress. In another study led by a graduate student in Dr. Roos's lab, we found that an increase in substance use as a result of the COVID-19 pandemic was associated with increased anxiety, highlighting the difficulty faced by parents in trying to manage the sudden onset and increase in mental health challenges. Despite the significant mental health concerns faced by parents, only 1 in 4 parents in our sample with unmet mental health needs reported accessing individual or group-based psychological services. This is really highlighting the fact that many individuals went without support for their mental health concerns. The takeaway from our work thus far and our job going forward is highlights the importance of supporting parents in managing and treating increased mental health concerns through more accessible and cost-effective services that really take into account the increased stressors and significant childcare needs within the pandemic. It's important to really ensure that these services can be accessed by a wide range of parents with very different needs, including the potential to offer virtual services that address mental health concerns across the board, anxiety and depression, and not specific to 1 or 2 diagnoses.
Thank you so much, Emily, for that very helpful summary about some of the mental health challenges facing parents right now. Finally, we'll hear from Dr. Jennifer Protege about her work relevant to this area. Thank you, Jen. You're on mute also.
Thanks very much, Leslie, and good evening, everyone. As my colleagues have so eloquently described so far, and as we've all experienced, life in the past 6 months has changed dramatically. But yet, by every indication, this virus is going to be with us for some time. So a group of students, Caitlin Merrill, Trevina William, and Kayla Joyce, as well as our moderator for this evening, Dr. Leslie Roos, and I, looked at the literature from previous pandemics and epidemics, starting with the Spanish flu way back in 1918, to shed some light some insight into the eventual return to socialized life and into the potential long-term impacts of the current pandemic. Historically, across epidemics and pandemics, children have been known to face significant challenges, and these include loneliness and depression, anxiety, grief, stress-related disorders, and stigma. As well, we found that many families struggled with conflict, economic challenges, and that children suffered academically as well as nutritionally, and many had fewer opportunities to play. Parent-child relationships may also suffer during quarantine due to altered communication and social interactions, and as families almost entirely became responsible for all of their household tasks. But it's important to note that not all children historically have been impacted equally. Most affected were female children, or girls, if you will, those who came from an economically disadvantaged home, and those who lived with a disability. We can draw some parallels from these observations to the current COVID-19 pandemic. So first, looking economically, so from 2019 to 2020, food prices have increased by as much as 3.5%. And unemployment from February 2020, the month before the pandemic, nearly tripled to May and June of the same year. Since these initial months of the pandemic, unemployment rates have fallen, to be sure, but they still remain much higher than they did before the pandemic started. At the same time, school closures in the early months of the pandemic meant that many families lost access to nutrition programs at school, and other services on which they rely. My major research focus is the burden of food allergy on families and society. So using data from the Parenting During the Pandemic study led by Dr. Roos, we found that amongst moms with children between the ages of 1.5 to 8 years, anxiety was significantly higher amongst moms whose children had a food allergy compared to moms of children who didn't have a food allergy. And this held true even after we accounted for things like childcare. Those data were collected based on surveys. We then went and talked to some of these families who further described this anxiety. They told us that in part they felt that their anxiety was attributable to some of the unexpected challenges of food shopping and differences and delays in food allergy testing and therapy, i.e. access to the healthcare system. In a separate study, we found that over half of families with food allergy reported difficulty finding foods that they typically bought before the pandemic, and that nearly 20% of families purchased foods with a, quote, may contain label during the pandemic, which they would not normally have purchased before the pandemic started. And here I want to acknowledge my senior research assistant, Mike Golding, for the analysis of these data. And finally, I want to mention some observations that we've noted amongst Manitoba families whose child is living with an NDD or a neurodevelopmental disorder. These again are data based on the Parenting During the Pandemic study. So Mike Golding, as well as Tessa Mamara and Kathleen Rollins, were research assistants involved in this project, along with myself and Dr. Roos. What we found was that families who experienced lost services using those anonymous surveys reported higher rates of depression compared to those who didn't lose services. But we also went then and talked to families about life before and during the pandemic. Families talked about how, in their views, pre-pandemic childcare and education were deemed to be suboptimal, which was evidenced in large part only once the children came out of care, i.e. when the services were closed. During the pandemic, perhaps not surprisingly, like many families, these families would also really struggle to maintain any sorts of balance. But these families described unique challenges as well, as they were concerned that their children with an NDD would regress as a result of limited access to services, despite shifting much of their attention to the child with an NDD and away from other children in the family. So all told, many of these lessons from history as they relate to pandemics and to child and family health outcomes seem to be applicable during the COVID-19 pandemic as well, and that investments in the access to mental health and other services are critical, as are the considerations to family financial health and a safe, affordable, and secure food supply. Thanks very much.
Wonderful. Thank you for that summary, Jennifer, and highlighting the important challenges that are faced by families with increasing food insecurity and some of the financial strains of the pandemic. We'll move now to our panel discussion. And I can see some audience questions coming in via Slido. That banner, perhaps we can add once more to the screen, www.slido.com. So we will start things off for about the next hour answering your questions, and feel free to pose questions to the panel generally or any specific panelists that you're particularly interested in hearing from. Looking at the list coming in now, there's a couple questions regarding childcare. There's a question of, at the broad level, how do we increase childcare access for families? And what advocacy or messaging can we do in the workplace when we might face answers such as everyone's struggling without additional help? Susan, perhaps you can start with this one.
I shall unmute. Thanks for that. It's an important question. I think one of the, if there's anything that's positive for a childcare researcher during this pandemic, is that all of a sudden everybody wants to talk about childcare, and it's got a profile like it hasn't had probably since World War II, actually. So I don't think anybody wants to give you a fight on whether or not it's important. The substance of the debate is what do we do about it? And here's where Canada faces a real challenge, which is that largely we've relegated the provision of childcare services to one of two kinds of groups. Either it's private businesses who do it as a business, a profit-making business, in the same way that long-term care home is a profit-making business, or we let nonprofits and charities own and operate and provide childcare services. And neither of these is a very stable basis for building universal access. So I think that maybe this is the moment where parents and advocates and allies and employers and researchers have to come together to say it's time for early childhood care and education to become a public service. So this means taking on a government right now in Manitoba that's quite austerity focused and doesn't want to spend any money, and trying to convince them that they have to grow their domain of responsibility. That's an uphill fight right now. A piece of good news in that is that we have a federal government for whom the penny has dropped, and which is prepared to make new dollars available to provinces, and which is talking very seriously about childcare. So you got a friend in Ottawa, you have some recalcitrance maybe on Broadway, but basically the answer, I think, is that parents need to just start insisting it's a public responsibility, and that we all need help.
Thank you so much. I'm curious from other folks' perspective, interdisciplinary-wise, in terms of mental health, what do you think the impacts of this childcare access is for families that you work with? In terms of pediatric access, what happens when we don't have adequate childcare?
I think this was something that came out through our qualitative work with parents who had a child come home from school, particularly during school closures, and were with that child, maybe had a toddler home as well who was previously in childcare, and then had a pregnancy that they were coping with as well. So just that idea of multiple compounding demands and really making parents feel exhausted, doubting their abilities to cope, and sometimes leading to anxiety or depression. So for a lot of the parents that we spoke with who were in the pregnancy or postpartum periods, it wasn't typically one stressor. It was this compounding number of stressors, childcare being a real key factor for folks and the issues that they were coping with.
I would agree, and I think the other issue that we're seeing is what was mentioned earlier, is that some mothers are starting to think if they need to reduce the number of hours that they work simply to take care of their children, which may create a whole other set of challenges.
Yeah, I agree as well with what's been said, and I'll just add as well that certainly with parents, if they're at home working, and with children at home more certainly earlier on in the pandemic as well, as it increases the frequency of positive parent-child interactions, but it also increases the frequency of any negative parent-child interactions. So really highlighting, as Kristen said as well, that demand and increased demand, and if parents are stressed or anxious, just the lack of childcare, those needs really can kind of highlight the need for breaks and the need to reduce some of those opportunities for more maladaptive parent-child interactions.
Absolutely. Thank you for all those reflections. I think it really highlights the potential widespread impacts of a lack of childcare on so many different aspects of family life. I'm curious too, about the question of how do you advocate for yourself and your family in potentially a less family-friendly work environment? And I think that that's, a really big question that, as Susan highlighted, is something that we want policy to come from the top down to make sure that access to childcare is equitable, and that, different individuals and different groups aren't disproportionately impacted by childcare closures and investment right now. I think in the moment, talking to people, talking to supervisors as a group can definitely be helpful to avoid individual penalties that you might face, potentially talking to human resources as well, and having a really specific ask. So if you would like to have the opportunity to work fewer hours and then come back, if you'd like the opportunity It feels, awful, frankly, saying that it's an opportunity to work evenings or weekends. So you're helping manage some of that at-home learning. There's different options that might work for every family. So having a specific ask can help in some of those tough interpersonal conversations at work or elsewhere. We'll go back to the questions now. A number are popping up. So one question that's been posed is if we have any comments about making the decision to become parents during the pandemic, the decision to try to get pregnant. The pandemic certainly seems to make the decision more complicated. Kristen, I'm wondering if you can speak on some of your perinatal work and potentially around some of the anxiety or stress that comes with this decision right now.
Yeah, absolutely. I mean, it's a big decision at any point in time to become pregnant. It's a big process to start to think about and engage in, let alone during all of the uncertainties of a pandemic. Pregnancy in and of itself, or engaging in the process of trying to become pregnant, has its host of uncertainties and potential joys and potential challenges. During a pandemic, layers of uncertainty are surrounding us, and as I spoke about before, in terms of compounding stressors, I think there are things that people are thinking about when making the decision of whether to try to grow their family or try to become pregnant. And I think for any person, it's a good process to get into. Pregnancy isn't something that we as people have full control over in terms of it happening, but it's great that people are having these types of questions and hopefully having these types of discussions within their household, with their partners, with those around them, and thinking through what being pregnant during the pandemic would look like for them or could look like for them, what being postpartum during the pandemic would look for them as people and as parents. What are some of the challenges that could come about? And sometimes anxiety can weave its way into these conversations, and people can start to notice, worst case scenario thinking or that kind of thing. So important to notice, when our thinking is getting more anxious or more negative, and to come back to that the moment or that type of conversation. But I think, as with other big decisions, they can be made more helpful if we have supportive folks around us to help have these discussions with. So I'd say, definitely it's on people's mind, and right now, in terms of, is this a quote unquote right time? And I think, it is such a unique individual decision and an aspect of life to embark on. The biggest thing I can say is to have those important conversations with the folks around you, and try to make some plans on how you would you might manage certain things throughout pregnancy or postpartum, particularly with some of the public health restrictions and that kind of thing. I don't know if other folks have things to add on that too.
I do. So part of that planning, if you're thinking of getting pregnant, will involve getting your name on a daycare center waiting list, because the average Manitoba parent will wait 16 months to get a space in Manitoba. So if this is even a glimmer in your eye, or if you're thinking about birth or adoption, really you can't plan too far ahead in a context of scarce spaces. So it sounds funny, but I actually, when I got pregnant with my own children now, more than 2 decades ago, after telling my parents, my second call was to start reaching out to childcare. And I'm sorry to say that 20 years later, it's not that much better.
Thank you for sharing those thoughts. Certainly a lot to think about for your specific family situation. And I know that knowing what things are going to look like 10 months from now, there's still a lot of uncertainty too. So I think, as much planning as you want to do, recognizing that some anxiety is probably normal for that uncertainty, and figuring out what you want to do to feel okay about whatever decision you need to make as a parent, and as someone who's looking to build your family, definitely makes good sense. Turning now to a bit of the mental health and family side, we have a question from someone looking for tips on supporting good sleep for children and adolescents during this time. Emily, would you be able to speak to this question?
Certainly. This is something that initially back in April and May, I certainly saw a lot of clinically, the shift from a regular routine at school to being at home, and there being less demand for that regular routine. And certainly it's something we commonly see in the summer, that sleep in kiddos tends to get a bit wonky when there's less of a routine. But certainly, the prolonged kind of period of change with school closures and into the fall can definitely impact that. The kind of quick tips I often give for sleep is around that kind of sleep routine, what we also like to call sleep hygiene. So having kind of a routine 30 minutes to 60 minutes before bed that starts that wind down period and starts signaling that it's time to get ready. So that could be kind of limiting screens 30 to 60 minutes before bedtime, doing any kind of relaxation strategy or reading a quiet book, and then, kind of getting ready for bed. The other one, when sleep really becomes a problem, if there's lots of trouble falling asleep or staying asleep or getting up much earlier than you intend to, would be really kind of limiting any other activity in bed. So limiting, studying or reading or screen use. And the much harder one is really limiting worrying in bed or doing any of that kind of unhelpful thinking, which is one we often kind of forget. And then really lastly is, and this one's can be harder for parents, but only being in bed when you are tired. So, sometimes an earlier bedtime, if you lay there for 2 hours, isn't as helpful. So really trying to kind of strengthen that routine, but also that connection with sleeping in bed, and bed is for sleeping, which is also easier said than done.
Thank you. Jennifer, did you have something to add on this topic? That was very, very helpful, Emily, both for kids and for adults.
Not necessarily to add, but to reinforce the need to maintain schedules, both for children and for adults, even on the weekends, which can be really tough when your kids are young and you want them to sleep in a little bit, so you get a bit of a break, Sunday mornings, for example. But to be able to maintain that somewhat regular pattern on the weekends, so that Monday mornings when they do roll around, regardless of whether the children are learning remotely or going physically to school, does arrive, and you're able to tackle the first day of the week.
Absolutely. On the topic of building support and seeing who's in your village that can provide you with support during this time, I feel like that term may have been replaced with bubble lately. Everyone's talking about who's in your bubble. Is it too big, too small? How do you decide? We have a question on Slido asking about what people might consider when they don't have a lot of family locally. Maybe they have family that they'd love to see or they regularly see, but they can't come into town because of quarantine restrictions. How can people access supports in this time? Any thoughts on this important question? I know I have a number of friends who don't have family in town, and it's certainly challenging for them in different ways.
I can speak to that a little bit. And I'll draw both on my experiences during the pandemic, but having originally had children and when we were living overseas, so we didn't have family close to us. And in order to maintain contact with family and close friends here in Canada, what we would do is rely a lot on virtual communication. So we talked a lot through various different platforms, Skype or Zoom or what have you, whatever happened to suit. But in terms of maintaining support here while in the city, even though if you have family close, but you are not able to see them for whatever reason, underlying health concerns, etc., it's often what I found to be quite helpful is to find somebody in your bubble or in your child's bubble if they're going to school physically, and with whom you have a trusting relationship, but to engage in play dates outdoors, for example, and the children can play and you can have a physically distant conversation, or close friends who you can meet for a walk and just take a short amount of time to let the children play together if they are, again, in the same classroom, so they are in that bubble, that cohort. But it's really a time to minimize contacts as much as possible outside your own immediate bubble.
I love those suggestions, Jennifer, the creativity, the bubbling with different people who you might already be in contact with through your child's school definitely makes good sense. In one of the mental health therapies that I do, we talk about the theme of radical acceptance. And it's this idea of accepting things that we can't change so that we're able to more effectively problem solve and acknowledge and validate our own discomfort. And that really comes to mind with some of these decisions that people have to make during the pandemic for being creative with bubbles, for doing things like outdoor play dates. I know I was pretty grouchy for the first few months that I didn't want to do things this way. It was harder. Now it's getting cold. I don't want to do that again. I don't want to go for a walk at 10 p.m. I want to invite someone inside. But if we can acknowledge those aspects of being willful and validate that it makes sense, while also trying to be willing to try new things, to go for that walk, to notice how great it felt, to get some exercise, to be outside, to be talking to someone. I think as much as possible as we can try to continue to be creative while maintaining social connection is going to be so important. We know that social connection and those feelings of support are one of the most important things for promoting mental health as parents, as adults, and for children as well. And I think one of the major risks for mental health and parenting during the pandemic is going to come from feelings of isolation and coming to a bit of a roadblock for not being able to problem solve or not being willing to problem solve anymore. So I think if that's happening, really encourage you to reach out. Maybe it's just telling a friend, I'm stuck, this sucks, I need more social support. You don't have to have the answers before you reach out for support. So I really want to encourage anyone who's listening to consider that if that's coming up for you. I can say, I remind myself of it daily that I need to be more willing to try different things. Any other thoughts on this idea of creative bubbling? If you don't have family in town, how you might seek social support as a parent, get tasks done that need to get done.
I'll just add a comment around.
There's some great points raised.
Go ahead, Emily, and then maybe Kristen add something.
Sorry, you go ahead, Emily.
There was a delay. Just around kind of experimenting. I know I'll speak for my own experiences as well as not having family in town, but experimenting with the things that I would generally like to do and how those can be adapted to a virtual means. And we've, with variable success implemented, Yahtzee nights and various things that we can do virtually, and kind of experimenting with some of those games to get not just that kind of social communication of talking, but also that kind of feeling of quality time, like you've done something different than having a FaceTime or a Zoom call, which a lot of us are also doing during the day. So really kind of experimenting and trying things out and getting creative, as has been said.
Yeah, I agree. I was going to bring in that aspect of behavioral experiments too, and how oftentimes there's a lot of barriers for asking for support. Pre-pandemic, it's hard for people to ask for help when needed. Pandemic, it's added levels of complication because people want to be safe with those that they're asking support from. So I think knowing people around you that you can trust, asking questions of them, and having these open, honest discussions with folks, and being open and willing to give it a try, to ask for support and see how it goes. There might be a worst case scenario that somebody responds in a certain way, or that it doesn't work out. Let's see, it might turn out really well on the flip side, and this might be turn into a regular person that you could ask for support from, or a regular activity that can give you a boost. But just to echo others' comments, that that openness and willingness to give things a try, that of course feel physically safe to you during this time of rising rates of COVID-19 in the province and around the country.
I think these are great. That's great advice. And into the mix, I would also encourage people who are parenting with co-parents to ask their co-parents to step up if they're not sharing the work equally. I mean, that research I showed about McMaster, which said that on average, Canadian women with children are doing 50 more hours a week than their male partners, says a lot about couples that aren't sharing the work very well together. And I think that there'd be a lot less stressed moms if more dads would step up. So that's often an option, right? To not try to do it always on your own, and to say to your partner that when that's appropriate, that you want to share the work better.
Absolutely. I think that asking people who are in your bubble or even under your roof is definitely something that important questions to have, even if they can be tough discussions to have sometimes, or might involve a change from what's been happening recently. Definitely appreciate that perspective as well. I think on the workplace conversation as well, encouraging all parents in a household to be having those conversations in the workplace. So to normalize that it's not just mothers that have these questions, it's fathers, maybe grandparents, aunts, uncles, lots of people caring for kids. Need to have some flexible options in their work right now. And I think as employers too, perhaps having those questions with people to ask how they need support at this time, whether it's parenting or caregiving in another capacity. On the topic of parents who have a lot on their plate, we had a question asking for advice about parents who might be struggling with mental health, feel like pursuing therapy is yet one more to-do item on their plate. Any thoughts on that dilemma? Kristen, wondering if you in particular might have thoughts from working directly with parents.
Yeah, absolutely. And that's something we hear commonly, is that this is a need from people to have more mental health support, more mental health resources, but it has to be accessible, and it has to be offered in a way that can be flexible and actually used by people who are busy, and for whom it doesn't make sense to go to a group for a certain amount of time per day while they're juggling perhaps childcare and work and the many other responsibilities that we've spoken about today. So I think if mental health is feeling like another thing on your to-do list, and you're already strapped, with your time and resource-wise, it probably won't get done like many other things. So if we could do some changing and thinking around mental health, and see if there's anything in your day that you could already incorporate to something you're doing that might give you a bit of a boost. Maybe that's a short-term sort of way to go. So one set of skills that I often talk about with the pregnant and postpartum people that I work with is mindfulness. So this idea that we don't have to be, sitting with an app to do a meditation. We don't have to be online with a therapist or on the phone with a therapist. One thing that we can all do, and I certainly can try to do more of in my days as well, and can feel more of a sense of groundedness when I approach my day with a mindful stance as well, is just trying in our moments to attune ourselves to where we are, attune ourselves to things that are surrounding us, how we're feeling, how we're thinking, and try to approach our moments with a bit more curiosity and a bit less judgment. And so noticing judgmental thoughts, and trying to come back to this moment. What can I bring to this? What can I learn about this? How can I be in this moment and be kind of fully engaged and fully connected. So mindfulness is one strategy that, certainly it can take practice for folks to do, but also it's one that's portable and involves just noticing our moments, trying to ground ourselves, whether it's feet on the floor or noticing visually things around us, noticing things we hear, connecting to indoor outdoor moments, and noticing some of those judgments and trying to take a kind of more of a curiosity based approach. In line with Emily's work and comments around sleep, always easier said than done. You think, oh, I'm going to be really mindful today, and then you go on automatic pilot, and that's that. There's an hour. So easier said than done, but that certainly is one approach to try to fit in a mental health strategy throughout anything you're doing in the day. See if you can engage with it and connect with that. Certainly, there are a lot of if people are busy, for example, during the day, but have a few hours or even a few minutes in the evenings after bedtime or that kind of thing to practice self-care, to do something that's important to them, to do something that gives them purpose or meaning. Oftentimes in conversations with people that I'm having right now clinically, there can be a feeling of loss of control, both with items with regard to the pandemic or activities with regard to pandemic and related restrictions or things going on at work. So seeing if there's an activity you can engage in the few moments that you have that gives you a sense of meaning or purpose or kind of active control can be helpful for folks as well. Other online resources that I'm sure lots of us can talk about. I know a number of us as well are in the works of developing some effective services for people who are pregnant and postpartum and parents. Some good websites that people can go to for information, but oftentimes it's again, it goes back to that question of it's hard to fit in. So thinking about you, and maybe it's the mindfulness approach that you can connect to and see if there's some of that mindful based behavior that you can bring into and thinking to bring into every day. Or maybe it's choosing one thing every day that you can feel like you have a sense of purpose, something that brings you joy, something that you feel in control of, and that kind of thing.
Yeah, thanks, Kristen. I was just going to add as well, this is really something that we noted in our initial study with maternal mental health, in that 20 to 22% of the sample who were accessing services were doing so through informal means, just looking up information or accessing more wellness-based apps. And so really, to us, kind of looking at that as, given the significant financial constraints, time constraints, childcare needs, that was really more of an area where parents had the ability to seek out some of these services. And I think we have the ability to link some online resources to this talk after the fact. And just kind of another one that, another skill or tool to kind of build on what Kristen was talking about is self-compassion. And there's some, a step within that for mindfulness, but also really, I think it's more relevant than ever, really looking at this shared humanity and taking the time to, a lot of us are very good at giving compassion to others and not as good at giving ourselves compassion. And especially in those moments where it's been a really hard day and there's a lot of unknowns and a lot of things that have come up that are really challenging. You might not have any more room in your cup to deal with whatever the next thing is, and just taking those moments to give yourself some kindness and some relief from those feelings like we're not doing enough. I know as well within Manitoba, early on in the pandemic, there was an online program that was launched called Ability CBT, which was a therapist-assisted program that was based in cognitive behavioral therapy, which we've kind of talked about with some of the sleep work, some of the kind of thinking and restructuring thoughts, as Kristen has mentioned. And it was a program that was module-based, so it wasn't, or it isn't as time-intensive in that it's kind of self-directed. So individuals could go about the modules and check in with a therapist at kind of different levels or different backgrounds, but all were trained in CBT. So that is a program that I believe is currently still available. It's one that you can self-refer to. We can connect the kind of link to that website to this talk as well. And that kind of really was highlighting Manitoba early on, seeing the need for this. And I think a lot of us who are looking at program development going forward are also kind of looking at this ability to have online supports that don't have the same scheduled regular weekly appointment to really try and address that need and recognize that parents don't necessarily have the ability right now to easily schedule a weekly appointment when schedules can be so much in flux.
Thank you both. These are really, really important points. And I think highlighting the many mental health skills that many people probably have right at home. So things that they know do help build up their resilience to stressors when they come about, and really scheduling in the time to do those things that we know build our emotional capacities and capacity to support others can be so important in this time. And to remind ourselves day by day, maybe it doesn't go so well on a given day and you check in afterwards, that why didn't it go so well, or maybe what can I set up tomorrow to have it be a little better. One thing that I always do like to mention on the topic of mental health is, in a time like the pandemic, feelings of burnout and stress are so normal. And I think that it's important to validate that there are significant stressors that are impacting most people right now. And at the same time, I think it's really important to note that some thoughts and some behaviors are not within the realm of things that we want to not address soon. So if you're at home and having significant feelings of hopelessness for yourself or for others, that you really don't know how you could go on another day, or if you're having challenges with substance use, noticing that that's really increasing and you can't cut it down when you want to, those are all signs to get help more immediately, and to not wait to reach out for help from supportive others, but also from mental health professionals. So really seeking services if you feel like you're in a place where you don't feel like you have much left to function with, and you're concerned for your well-being, or perhaps others are concerned for your well-being. On the topic of resources, I also wanted to mention we are running a study in the Hearts and Minds Lab called the Bridge program that offers evidence-based mental health support for mothers who are managing depression right now, mothers of young children from 3 to 5. We can put up a link to that a little bit later. But I did want to mention that we will be enrolling families for the next few weeks for those services. Also on the topic of online services, there was a really important question that was raised about the extent to which family resource centers might be offering online supports or different, distance options with the current restrictions. Susan, do you have any insight on these programs?
I saw the same question and I went and took a look. And so some of the family resource centers that I know best are still greeting and welcoming families and children in person. So Wolseley Family Place for people who are in that part of town, the Andrews Street Family Center for those in Point Douglas, some of the women's resource centers, North End Women's Resource Center and the West End Women's Resource Centers. And they ask you to mask up and not to come if you're feeling sick and to follow all the normal public health. But many of our community agencies are there for people. They're, places to go for you and your children and to get support and to talk to others, and maybe just sort of sort out, as Leslie's asked, how much of this is normal and how much of this is outside of something that we're all feeling and needs special help. But yes, you can get live help. It's not all gone virtual in the family resource world.
Absolutely. And Emily actually works at an organization that does offer some online help. So if people are looking for one-on-one therapy online, Emily, do you want to talk a little bit about some of that clinical work that you do in the community?
Yeah, so KidThink is an organization that supports children and their parents and families. And currently we are still offering virtual services, primarily offering virtual services on a case-by-case basis, assessing whether in-person services are warranted given the current restrictions. So that is an option if families are looking or preferring virtual services. KidThink is certainly offering those currently. I do believe as well that services through the Child and Adolescent Consultation Service at HSC, the Family Therapy Service at HSC, those are still also offering virtual components as well, I believe.
Absolutely. On the medical side of things as well, I believe that pediatrics is still offering, different appointments with family docs. Jennifer, I'm wondering if you could speak to that at all, if you know what's going on with pediatric care.
Sure. So there are certainly, I'm not a pediatrician, I'm a PhD trained, but what I can say is that certainly from the allergy side, there are regular appointments that are still occurring. These may be held virtually, depending on the physician and the patient and the family, what they decide. There are some opportunities where there would be in-person visits, such as a pre-scheduled oral food challenge or some oral immunotherapy, depending on where the child is during the course of treatment. But there is certainly a hybrid, if you will, of types of care available both virtually and in person. But I would reinforce that it's really it's a mutual decision that should be taken between the provider and the family.
Absolutely. Thank you so much. I know I've done some speech language work with my own family and was able to do online visits. So I can say from personal experience that it went better than expected. And there's actually some really cool things about being able to talk to someone from in your home environment. I know often when kids come into appointments, they might be a little nervous or not themselves. So for better and for worse, I think we can see sometimes what families might be managing at home when you can do those telehealth appointments online. So there's actually some really nice things that can be gained in that sense as well.
And I would say, certainly some of the work that we're doing in this space in terms of research and the effectiveness of the of virtual care is that it really depends on a lot of different circumstances, but there definitely seems to be a large interest in virtual care, and particularly once the rapport is already established between the family, the patient, and the care provider. But that rapport may be a bit more challenging to develop if they've never met.
Absolutely. Okay, so we might switch gears a little bit. There's been some questions that have come up around the ideas of preparing for if future lockdowns happen, or how to prepare if you or someone in your household needs to quarantine, what that might look like. I think this is something that many folks on our panel can weigh in on. I can start as well by saying that one of the things that I talk to families about is if they're managing a lot of anxiety around, last March was really hard. April was really hard. How am I going to cope if this happens again? If my kids are home from school. And one of the most effective ways to cut that anxiety can be to come up with a plan. So, best case scenario is you never have to use it. But if you do have to, what would you do? How would you identify people to be in your bubble? How would you manage food? How would you manage childcare, work, anything else, mental health, social connection, sort of come up with what your plan would look like and have some of those initial conversations for, if this happens, could you help me out? If this happens, would you be willing to do a food delivery if grocery stores get busy and I'm here, trying to figure some of those important questions out. Okay, I'm gonna sort of pass it off to other members of our panel. How would you advise that families prepare for either going into quarantine or if we're in another lockdown and increased restrictions where we're all looking at having less less freedom to go about than we've been used to for the past couple months.
Yes, really, really important topic and question. And I think lockdown is something that's on a lot of our minds right now with rates increasing. And I think you raised a really important point there, Leslie, around anxiety. And if we're feeling anxious about an impending lockdown or quarantine, sometimes when we're feeling stressed or when we're feeling anxious, we're prone to certain ways of thinking. And one of those ways is to overestimate the threat or overestimate how bad that thing is going to be for us. And another is to kind of undermine our own coping or to think that underestimate how we're going to be able to deal with those things as they happen. So if you're noticing anxiety around it, I think the most important thing that you can try to do is to notice those feelings, to notice thoughts that you're having about it, and to come back to the moment and think about that plan. Have those conversations around the people that are close to you that you trust, and make some plans for how you can reach out for support. I think reflecting on March is an okay thing to do as well, in terms of how did you cope with the prior lockdown and what did you find helpful about that? Were there certain things that you and your family or those co-parenting with you did that worked well? Were there certain things that didn't, and how would you change those particular things? So I think noticing any anxiety around it, trying to take a breath and remind yourself that hey, you're here and you made it. Now going forward, what can you change, or what can you do that was similar that worked really well for you?
I would agree with what my colleagues have previously said. The other thing that I would mention is that we've been through this once before. And when we were thrown into this situation in March, we really had so little time to prepare. Whereas now we have a better idea what it means to have children at home and studying and working. So taking some time to prepare, to make a plan, as Leslie said, but also to think about the physical space in your own home and determine how that space can be best used. So in my home, for example, we thought, okay, if the children are home from school, where would they eventually work if they needed to be home for some time? Where would be appropriate places? Are they going to be at the kitchen table with us, or should they have a dedicated corner in another part of a room or another part of the house? So taking some really practical decisions, and also that activity can help you work through some of the, may help you work through some of the anxiety of the impending lockdown.
Absolutely. Susan, would you have any thoughts on advocating for childcare or figuring out what to do if your child's in quarantine? I'm actually not quite sure if this is directly in your policy lens, but I would be curious if your child has a sniffles or has to quarantine, how to handle that.
Yeah, right. Well, it's very clear that there's a paradox to all these stay-at-home rules we're trying to live with. Right, on the one hand, it's to keep everybody as safe as possible. On the other hand, it's also causing lots of stress, and the stress is being disproportionately carried. If I were home with kids, I would be doing my best to follow some of the great advice I've heard tonight on the panel. I'd also take the chance to write a few letters to my politicians and make a few phone calls, and try to move some public policy stuff forward. I mean, I think what we're trying to say tonight is that, what's going to get us through this as well as we can is a mixture of resilience on our own terms and our own little bubbles, and also trying to change the structures that we engage with, right, so that they're more responsive. And both of those can be done together, and maybe you'd feel better writing a letter to your politician explaining why they better fund your childcare center better so that it can be open when your kid can go back.
Absolutely, putting some of that frustration and anger into action for people who can maybe control the funding at a higher level better than we can as individuals. I appreciate that sentiment for sure. Emily, do you want to talk a little bit about how parents might manage some of the challenges of actually moment-to-moment parenting at home? With sort of stir-crazy kiddos, stir-crazy parents, what does that look like?
Yeah, I think I want to start by echoing a lot of what people have said as well, in that 6 months ago the shift did look very different than everyone, for good or bad, has 6 months of experience under their belt, and I think that there's a lot to say for that in terms of just whether you can evaluate all the things that didn't go the way that you wanted to, and how to kind of make a shift. But I think that those kind of unexpected changes of having kids at home or not, having that plan, whether that's helpful from a parenting stress and anxiety and mental health perspective, whether that's of benefit or not, it can be of benefit, as well as if you have a child who has a lot of COVID related anxiety. There's a lot of uncertainty around the school scenario of what other peers are wearing masks, and the change from day to day, or if there has to be a quarantine all of a sudden. And so having that plan in place, if you have a kiddo who asks lots of questions and shows that they're worrying lots, can be really helpful in adding an element of controllability to a very uncontrollable situation. So that can be something kind of useful to keep in mind, as well as it might not help reduce parent stress, but it might help to also kind of give kiddos a sense that there's a plan in place for if these things happen. But I think really, there's no hard and fast rule for this, and it's mostly a nice combination between structure and flexibility. So there's a plan A for what that could look like if school shifts to home, or if there's a day when the kiddo can't go, if they have the sniffles or something. There's a plan in place, but there's also that flexibility, and that could look like more screen time even. There's a balance here between ensuring that parents also can attend to their stress and mental health and the things that they need to get done in the day too, with having a bit more screen time in this era that we're in a totally unexpected day is totally fine. And looking at kind of other elements of wellness, if kiddos are getting time outside or playing or socializing enough, then adding some of those special pandemic activities to help manage parents' time and stress as well can be more beneficial in terms of just overall family wellness. Mm-hmm.
I completely agree, Emily, and as you were speaking, was thinking about just that importance of managing expectations, and how going back to your earlier comments too around self-compassion. I think if we do go into another lockdown, one of the main themes that came out of some of our qualitative interviews and analysis of open-ended survey research through both of the studies that I spoke about earlier, the parenting during the pandemic study and the pregnancy during the COVID-19 pandemic. One of the common themes that we found was people placing lots of expectations on themselves, and those often competing roles that people are fulfilling. And some of my clinical work with Dr. Trish Fear at the St. Boniface Hospital Anxiety Disorders Clinic through the Department of Clinical Health Psychology, we developed a program called Overcoming Anxiety in Pregnancy and Postpartum. And one of the most meaningful parts of the discussions we have with people who are pregnant and up to a year postpartum are often around managing those expectations, and this idea of the myth of the super mom or the super parent, and how we can, as a society, I think, expect ourselves to do it all or to do too much. And so one part of the planning or potential planning for a lockdown could be to look at the expectations that you have on yourself as a parent, and to say, what can I let go? And if screen time is that thing that increases a little bit for you and your household, so that you can feel okay, then let that go. If laundry is that thing, then take that off the list. But I think this kind of ruthless prioritization of what do I need to do in the day and what can I let slide for my mental health and well-being and that of my family as well. Consider that. So note those expectations and see if we can be kind to ourselves as parents and scale back in areas that we can.
Thank you so much for all of those useful tips. I know I think about this stuff every day, and I still find it really helpful when I hear people who I trust say the same things that I think about. It's always a good reminder. I feel like I can't hear this advice enough. I want to invite folks in the audience to post any additional questions that you might have. We have about 10 more minutes, so we might have time to answer 1 to 3 more questions right now. Thank you for putting up that notification. One just final point that I wanted to make based on some of the parenting pieces that Emily mentioned is when there's lack of structure with school or childcare, one thing that we often observe is that kids' bedtimes get super wonky. I can also say that that's happened in my own family. And that's one of those things that's very much, a family value, what time you want to put your kiddos to bed, how you want to wake them up, what nap times look like. But if you are noticing an emergence in kiddos' behavioral challenges, whether that's, moodiness or more outward, aggression or defiance behaviors, having a really structured bedtime is one of those interesting things that has really protective effects on promoting good behavior during the day. So ensuring that kiddos get enough sleep, you have a lot of time starting bedtime early, can be really helpful as a first line of defense if you're noticing that things are a little bit tricky. One of the things we often talk about, especially with younger kids, but I think it's relevant for adolescents and friends and family too, is this idea of co-regulation. So if you're an individual at any age who's having a hard time regulating yourself, having social support and people around you who can say, I've noticed that you're having a really hard time in the morning, but you're up till 2 a.m. on your cell phone, you're Netflix watching a whole bunch of movies till really late at night. Come to bed at 10 tonight. Maybe try it this way for a week. Could be really helpful for promoting positive mental health, sort of a universal helpful tool. I want to go to our questions one more time from Slido. We have a question from someone wondering how to support friends or family who might have COVID and live in another city. A tough question. I see Susan's face reacting to this one. Any immediate thoughts that come to mind on supporting loved ones in another city, perhaps who are managing their own challenges with health, well-being, or stress while sitting with a COVID diagnosis, which is becoming increasingly likely that we might encounter that?
Sorry, Susan, go ahead.
Sorry, I just think what a worry it would be to have family far away and be sick and be unable to be there, as of course we can't. But my dad, who's older, lives in Toronto by himself, and he's of a generation that was not very comfortable with technology. So one of the things I've done for him is set him up with grocery delivery long distance. It's a practical thing. It makes a huge difference. He doesn't have to go out to the grocery store so often if I can just order things up. Not everyone can do that. It's not in everybody's tool bag. But for those who it is, it's one very concrete idea. Made a difference to my dad.
I would say specifically to those who have friends or family who have COVID and who live in a different city, listen to them. Don't, recognize that, tell them quite straight that you don't have the answers, but you'll always listen to them no matter the time of day, no matter the time of night, that you're only a phone call or a WhatsApp call away. Sometimes just knowing that you can communicate and rely on somebody, just allow them to speak freely and with no fear of judgment at all. Just be there for them.
Yeah, I agree. The first thing that came to mind was that reflective listening and validation, and just sometimes just helping to reflect what that emotion is that they're feeling. Can do a world of good. It can also be hard to be that person for somebody as well, and to have family, as Susan said, that's not in the city, that that you are trying to support. And really that kind of brings us back to what Leslie had mentioned too, around radical acceptance and just also kind of taking care of yourself and those very challenging situations where you can't physically do something and maybe you have the ability to do something virtual, which can be super helpful, or maybe not.
Thank you so much for these, thoughtful responses. And I appreciate too that some of these things are really unique circumstances that we find ourselves in, and it's normal to not have an answer. And so I think, more than ever, if you find yourself saying, I should have the answer for this, or this should be easy, or I should have this figured out right now, that is a great time to sort of challenge that shouldism, as we talk about sometimes, to reach out for help. Say, is anyone else feeling this way? I feel like I hate that I don't have this figured out. My guess is that there are people who you might be connected with. There's also a number of, parenting forums that can be supportive online for talking about some of these shared problems, and knowing that you might not be alone and having a lot of questions about how to parent effectively, how to be a parent and care for yourself effectively with all of these really challenging pressures. I want to take a few moments to put a few links up here that our IT team has put together. The first one is that online anxiety CBT link. Emily, could you just remind us about what that program is?
Yeah, so that's the therapist-assisted but module-based self-directed therapy that's available free to any Manitoban just through following the link. It's self-referral. You can set yourself up with that without having to go see a physician or therapist already.
Great. Thank you so much for highlighting that. Kristen had shared Crisis Response Center services. Perhaps we could add that link. And Kristen, could you talk a little bit about what services might be available through Crisis Response Center?
Yeah, absolutely. So folks can go to the link to find out more information, but they're located on Bannatyne, and folks can present there in person. Folks can also call Mobile Crisis Service at 204-940-1781 to get assistance if people are noticing thoughts of wanting to hurt themselves or end their lives, or are noticing those thoughts in others. The Crisis Response Center is a place that one can go to in person. Visit their website as listed there, and there is the Mobile Crisis Service number to call as well. That's 204-940-1781.
Thank you so much. We'll switch in a minute for a couple opportunities to be involved in research on parenting and well-being during the pandemic in a minute, but I also just wanted to do one more plug for KidThink services, which Emily had mentioned. You can just Google KidThink Winnipeg. That's an organization that provides services to families of children 12 and under, and they really pride themselves on having a short waitlist time. So if you're having challenges parenting, increasing behaviors, a lot of parenting stress, they can be a great resource to access as well. Jennifer, do you want to talk a little bit about some of the research opportunities in your research group soon?
Absolutely. Thanks very much, Leslie. So we have a number of studies that are ongoing right now. Our website is jenniferprotiter.ca. And specific to this evening's discussion, we're recruiting families who have been involved in virtual healthcare, specifically as they relate to allergy, and wanting to understand how they thought about what they thought about their experiences and how it compared to in-person visits. And in the next little while, we'll also be launching another study that is looking at maternal and infant relationships, and that will be posted shortly on the website, probably within the next 2 to 4 weeks.
Wonderful. Thank you so much. Final link we'll put up is Hearts and Minds Lab, and that is our research group which looks at providing parenting and mental health support for parents of preschool-aged children. We have one program actively recruiting and a few coming up in the next month. Susan has also identified, a couple more links for Facebook groups of parents and allies for childcare. All of these will be added to the YouTube link for this presentation today. Looking at the time, I want to close. I'm sure that people have places to be, or if you are like me, I can be very thankful that tonight I did not have to put any kiddos to bed. I heard them trying to open my door a few minutes ago, and then everything's quiet now. Magical. So I would like to thank everyone for engaging in tonight's discussion. It was so fantastic to hear from so many different experts around these different topics really relevant to parenting during the pandemic. I know that I got a lot out of it. I hope everyone else did too. I would also like to encourage the audience to tune in again for another cafe discussion on November 18th at 7 p.m. entitled Eating the Whole Grains in Canada's Food Guide. More details for Café Scientifique can be found at umanitoba.ca/Café Scientifique, as well as a link to the video of tonight's discussion, which will be posted in just a few days. Thank you so much, everyone, and have a good night.